Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and boy, do we have a show for you. For those of you who are interested in A, nose jobs, rhinoplasties, and B, live in some place in the world where you are not sure that you can find the person you're looking for and are contemplating traveling, well, then this is the show for you, because we are lucky and blessed to have Marissa, a beautiful patient of mine from Vancouver, who's joining us and helping us navigate this idea. Marissa, how long ago did you do your nose, honey?
December, so 5-6 months ago.
Perfect. So 5-6 months ago, we had the honor of taking care of her. She visited us all the way from Vancouver, and let's dive in. So, welcome to the show. Thank you for coming virtually. That is. What's the temperature like in Vancouver right now?
Well, I'm in Vegas now, so it's hot.
Better. Vegas.
Yeah, it's hot.
Are you relocating to Vegas?
No, we come down every couple of weeks. My boyfriend plays poker, so it's quick
Beautiful.
and easy.
I love it. Vegas is good stuff. You watch shows, have amazing dinners.
Yeah.
I commend him. I can't gamble. I get so anxious. I give myself $100.
I get anxious too.
I gave myself $100 budget just so I can say that I did it. You can only gamble if you are like, you have to have the right personality. You're like, yeah, whatever happens. I am like, oh my God, what happened? I lost. Two chance.
Yeah.
Ironic, because I find surgery very relaxing. So, all right. So let's dive in here. Let's do a little introduction about you. How old you are. Tell me about what triggered this desire, how long you've been contemplating it, what your process was, your research homework process. How did you and I come together as a union? Why don't you tell us a little bit?
Well, I'm 26, and I had always had an insecurity. I had like an Italian nose. I had a little bit of a ski bump. Is that what you call it?
Sure.
And I hadn't decided I would do a rhinoplasty at all. It was actually my boyfriend, who has an Iranian nose, who we had set up the consultation with you. And then he backed out of it. But I had found you just on Google. I had read a ton of reviews. I had, looked at Beverly Hills mainly just because it was the Mecca Center for plastic surgery, and it's nearby Canada, Vancouver, and that kind of thing. So he had done his consult with you, and he really liked you. He thought you had a lot of knowledge, especially in ethnic noses.
Mm-hmm.
And then, he decided not to do it. And he said, oh, why don't you do it? I know you don't love your nose and have a little bit of an insecurity. And I had always disliked how my nose was a little bit bulbous right in this area. So, yeah.
Okay. So, typical story, right? You're a beautiful young lady. Don't really need anything. I would argue, and you and I talked about it briefly, I would suspect that most people that you had mentioned or said that was like, hey, yeah, I'm thinking about doing it, or I'm doing it, we're like, what? Because while you may not have liked those elements and they were standing out as obvious as day to you, globally, you are a beautiful young lady. And so the people that see you don't see you for those small issues. And they're like, are you crazy? Oh my God, you've been on TikTok too much. You're so, blah, blah, right? Right. Is that correct?
Such a big surgery for such a little feature.
Right. So listen, people who love you, God bless them. Their job is to kind of tell you they love you, tell you the truth, and then try to deter you from doing anything that they think is catastrophic, right? So I think that everything comes from a good place. But the reality is that no one else can make you pretty. No one else can make you feel pretty is what I meant to say. No one can make you feel a certain way. They can make you feel ugly by telling you and mind screwing you. But the truth is, no matter how much myself or your friends or your boyfriend tells you you're beautiful, if something bothers you, it bothers you. Minor, not minor, major, it doesn't really matter. And we all people know that there are things about ourselves that bother us. The question is not how significant is the issue, but rather how much does that issue bother me? Because sometimes insignificant things bother us a lot, and significant insecurities we can somehow tolerate. It's odd, but it's the way that it is. So here you are, beautiful young lady. There are some elements to your nose. You have an Italian nose, a bump here and some bulbosity, and your cartilage was a little visible, and so on and so forth. So you and I meet, and we discuss your nose. And you can't do a rhinoplasty consult without examining someone. You have to look in their nose and feel their skin and talk about skin thickness and things of that nature. So tell me, did you remember what our consult was like and what that experience was? What transpired during our consult?
Well, I remember our consult was virtual, and you had said, you're not going to make a huge difference to my nose. There isn't a lot you can do. It's going to be very minor. And I was okay with that. You know, as long as you got rid of that little bump, I was okay with that. You definitely said
so that's important for you to highlight.
Yeah.
So I think it's the job of the surgeon, as I always try to do, is to set expectations and discuss things in a way that makes sure that the patient, the person who's having this done, and you, the surgeon, are on the same page. When I look at
realistic.
Right, when I look at your nose and I look at you, I say, "What a beautiful young lady." And then when I highlight your nose and be very specific, I was like, "Yes, there's a slight bump here. Agreed. Check. Your nose is not droopy. Yes, it's got some roundness. Check. And the bones are a little wide, like most Italians. Check. But by and large, I think your nose is pretty good. Therefore, when we do your nose job, the amount of change will be seemingly subtle.
Yeah.
But to you, it will be major because there's stuff that drives you nuts."
Exactly.
And it's really important because if I came and said, "Oh my God, we're going to change this, we're going to change that, it's going to look like this, it's going to look like that," I would almost imagine going like, "What?" But it's really not that bad.
Yeah.
So that's good. I'm glad that, that's something that you recall me highlighting. It's like, hey, doable, but it's not going to be some, oh my God, major change. What else do you recall of our dialogue?
I remember
you remember us talking about the breathing component and that most rhinoplasties are done just for cosmetic reasons. Like I said, how's your breathing? And your breathing was for what?
I did have always a runny nose for some reason, and I did have like I have allergies, and I always felt stuffed up. And so ever since I had the surgery, I feel, my nose doesn't run. I felt like I had a lot more benefits internally than I thought I would.
Okay, so then let's highlight that. Here you are, quintessential patient, young, pretty girl, doesn't love her nose, wants the cosmetic improvement. And then I'm asking you all kinds of questions. How's your breathing? It's okay, I guess. And do you have pets? Well, I have a dog. Okay. And do you have runny nose? Da, 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 da. And you're like, yeah, I'm here for my cosmetic nose. My breathing is fine. But the reality is that you don't know shit from Cheyenne about your breathing. And the reason is this. You only have one point of reference. You know you. You don't know what's better than you, and you don't know what's worse than you. You just know you. And what happens is when you do a cosmetic rhinoplasty, most cosmetic rhinoplasties are making your nose smaller, cuter, more refined, narrower. All of those features, smaller, cuter, narrower, look good, breathe shitty. You are making the airway smaller. So if your breathing is average, which yours was average, before surgery, and I ignore your breathing because you didn't mention it, you didn't say I had a breathing issue, and I don't give a shit, and I do your cosmetic rhinoplasty, and now your nose is so cute, and then you go to jog, or go to Pilates, or you're just, huffing, your breathing is terrible, then you're going to notice your breathing is not good because it was better, and now it's crappy, and you have a point of reference. So what did we do? Every rhinoplasty, when I do a rhinoplasty, gets breathing work done, whether you ask for it or not, whether it's a problem or not, because invariably we're trying to offshoot the work that we're doing cosmetically. So if we do your surgery and your breathing's no better than it was before we started, we're a winner because it should be worse afterwards. I actually use Vegas as an analogy because if I go to Vegas and I gamble for 24 hours and I come out and I didn't lose $1, I'm a winner.
Right.
Because the norm is to lose money. When you do a cosmetic rhinoplasty, the norm is for your breathing to get worse. So if you come out and you're no worse, it means you actually broke even. So what I do with everyone is a septoplasty, taking the inside of the nose that's a bit crooked, and I improve that. I take that cartilage out. And in addition, I make the turbinates, the swollen parts of your nose, and I shrink them down and I expand everything so that your breathing is better. Our goal is either one of two things. You don't notice any improvement, which means that it's improved because your nose is smaller. Or better yet, you're like, hey, you know what? I'm breathing better.
Yeah.
Which it sounds like you were, right?
I have clear breathing now.
So isn't that interesting? So
Yeah.
you never came in for breathing.
No.
Your breathing wasn't even on your radar. And now your breathing is better. Wouldn't you say that's such a great improvement in your quality of life when you sleep?
Absolutely amazing.
And okay, so breathing is underestimated because why? We can breathe through our mouth.
Yeah.
So we can adjust and learn to live without nasal breathing. Okay, so in addition, we talked about one other item. We talked about the difference between reductive and reconstructive rhinoplasty. Remember I told you that septum I'm taking out so that your breathing is improved? What did I tell you I do with that cartilage that I remove?
Oh, I don't remember.
Remember, we discussed, and I said to you, in most instances, rhinoplasty is about making noses smaller. We remove the bump, we remove the cartilage, we break the bone, and the net effect of traditional rhinoplasty is your nose is smaller, cuter, weaker.
Right.
Smaller, cuter, weaker. Why weaker? Because we removed a bunch of structural pieces. So if I go to a bridge and I remove a bunch of cables and a bunch of bolts, it's smaller and it's weaker. So when you look at celebrity noses, why I pick celebrity noses is because they're easy to see over time. Bella Hadid is one of them. There are other ones that are like that. You notice that at the beginning, they look pretty okay. And then like 5 years, 8 years, 9 years later, they're like, whoa, what's going on with their nose? And they're starting to collapse. They start getting pinched in areas because they've removed structural elements to make the nose smaller. So that's traditional rhinoplasty. The way that I do my nose job is a more advanced technique called reconstructive rhinoplasty, which means that we do everything we would do when you were doing the traditional rhinoplasty, except we add structure to support the areas that we weakened. Add structure. What the hell are you talking about? What structure? Cartilage. What? Whose cartilage? Yours. From where? From your septum. Ah, the septum that you use to make my breathing better, you recycle it in your nose? That's right. So we do your septoplasty, improve your breathing, remove the part of cartilage that's kind of deflective, and then I cut them up into little pieces and I reinsert in your nose to create support in the areas that I weakened. Those areas, for example, are the nostrils tend to get collapsed. And we know a classic pinched nostril. They put in the tip. If you'll notice, your tip is stiff.
Yeah.
Tap your nose.
Yeah.
It's stiff. Why? Because we put cartilage in there. Not for now, for when you become 47, when you become 53, when you become 64. Most noses droop over time because like your neck droops, your breast droops. Noses get longer. But when I put structure and support, it stays where I put it 25 years ago. So that is another element that's very important. So those elements, breathing and structure, are in addition to just a garden variety. I don't like my nose. It's ugly. I want it cute. Yeah, that's fine and all, but over a long period of time, it will start becoming an issue. And so we want to make sure that we do those things when we do the rhinoplasty. And I do it in everybody, as in, for example, in your instance, even if it's not something that bothers you. So in terms of your recovery, you're how far out? 6 months, right? About 5, 6?
Yeah. Yeah.
And so you're starting to notice the swelling go away.
Yeah.
Right?
I find I only get swelling if I drink a significant amount of alcohol or if I fly or if I'm super dehydrated. And then I'll do the massages that you told me about and it'll go away.
Right. And you're going to start noticing something interesting. Noses are special because the recovery of a nose is nothing like the recovery of anything else that we do. Breast augmentation, eyelids, chin augmentations, facelifts, tummy tucks, lipo, every other surgery we do, recovery is quicker. The nose is special because it traps fluid.
Right.
And no matter how you dice it, no matter what you do, no matter how you complain, it'll take 12 to 18 months for that damn swelling to go away. There's a lot of hand holding. The thicker your skin, the oilier your skin, the more acne you have, aka ethnic people, African Americans, Latinos, Asians, the more swelling you have. And the reality is that you just have to be patient. So it swells and swells and swells, and some days are good and some days are shitty. And then as you start getting near 9 months, 12 months, 18 months, 24 months, you're going to notice it getting smaller and smaller and cuter and more petite, and the tip shrinks. And the area that takes forever is the tip. The bridge is fixed right away. The bridge looks good automatically. Holy shit, looks great. The sides of the nose are narrow. That looks good right away. The area that takes a good 12 to 18 months is the tip. And if you are not a patient person, then don't bother doing your nose, because it's just the way that it is. So you're going to now start seeing significant improvement over time, over and over and over. Like every month it'll be like, holy shit, even better. No, oh my God, even better. And it's going to get better and better. All right, let's take a quick break. We're going to take a break and come back. And then we want to talk about, why the hell did you get in an airplane and fly across the country to have a nose job? You're in Vancouver, for the love of God. Just get it done there. There must have been a reason. So I'm going to discuss the idea of traveling for surgery. All right, guys, let's go take a quick break. We'll be right back with Plastic Surgery Uncensored. Welcome back to the second half of Plastic Surgery Uncensored. I am having an awesome time with Marissa, chatting about noses. And now we're going to chat about the second half, which is destination or traveling for plastic surgery. So there are two scenarios. Scenario one, you travel. It's a disaster. It's a terrible idea to travel. Why on earth would you go to Nicaragua? We have patients constantly, we see on the news, that travel far and far away, Turkey, et cetera, and get nose jobs and breast dogs and BBLs and die. And on the flip side, it's atta boy, atta girl, good job, good on you, smart. You left Hopunk, Mississippi, where there was no one there capable of doing it, and you went to New York City, where is the mecca of, for example, facelifts. So, Marissa, you live in Vancouver at the time, and you decided, I want to do my nose, whether it was because of your boyfriend and you or whatever, but at some juncture you decided to do it, and you opted to travel to do it. So tell me about what the thoughts were. Were you scared? Were you optimistic? What pushed you to go away to do it as opposed to locally?
The reason why I didn't want to get a doctor to do my rhinoplasty locally was because I have several girlfriends who have gone to doctors in Vancouver and just not happy whatsoever. One of my girlfriends has had 3 revisions in Vancouver, and she's still not happy. She's having Kenalog injections in her nose still after 7 years. So I had, I had no other options. I wanted to try somewhere that, is well known for their plastic surgery. And I read all your reviews.
All of them were lies.
Seen your before and afters. And I have gotten 3 breast augmentations in Vancouver before, and with 2 different doctors. And neither of them I had the faith that they would be able to do my nose well. Right. And with you after this rhinoplasty, I'm just planning for after I have another child. I can't wait to do a mommy makeover with you. I have all my faith in you.
And we really, I can't tell you as a surgeon, the idea that a human being that you don't know comes to you, you can go to a lawyer or an accountant, but a human being that comes to you and entrusts you to go under anesthesia, have an operation, wake up, hope that whatever you did they'll like and survive. It's an immense responsibility, and it's a great, great honor. So what you were saying essentially, and this is the idea, and this is what you have to determine if you're sitting somewhere. The question is, and I always say this, if you live in an area in which there are individuals who you believe wholeheartedly they can accomplish your goals, your surgical outcome, and do it well in your hometown, wherever that is, then by all means, do it at home. Staying local is without a doubt easier and cheaper. Yeah. It's easier because you just drive to the clinic and then you drive to your own home. Yeah. It's easier because all your follow-ups are local. It's easier because you are familiar and there are people to take care of you. And it is without a doubt cheaper because you eliminate the travel expense. You eliminate the stay expense. And presumably when you go out of town, you spend more with the surgeon. However, if you are incapable or do not feel comfortable, you 100% should not stay local. The idea or notion that I'm just going to suck it up here is just utter stupidity. You already know in advance that your heart of heart tells you that there is not an individual here that you are excited about that is going to do your facelift or your breast aug or your tummy tuck, that they're honest, they're faithful, their outcomes are outstanding. By the way, you can find a surgeon whose outcomes are outstanding and you're super excited about them and they do a shitty job. So God help you if in advance you already know that they're not that good and you're just like, I don't know, I have no other choice. You absolutely have another choice. The other choice is save money and go somewhere where you think the outcome is going to be excellent. You never want to do surgery coming from a space of, it's good enough. That's a terrible place to come from. So if you were going to find a dentist in another state or another country, you'd be a fool. You need to see them often, and it's not that important. But if you want to get brain surgery, you want to get spine surgery, you want to get cosmetic surgery, and you don't have someone local that you're like, oh, this person's amazing, you better find someone somewhere. We live in an international world. You get in a goddamn plane and you travel somewhere. Yes, it is more expensive. And with cosmetic surgery, the beauty of it is it's not necessary. So you can save. I don't have to have it this month. So if it costs X and going to another place costs X plus Y, then save for the Y. Because I assure you, what you don't spend in Y, you will spend tenfold in dissatisfaction or revisions. Yeah. Right? And that has been your experience, correct?
Yes, exactly. And then you won't have to do it again.
Right. And so now, okay, great. Love it, Dr. Rahban. You sold me on the idea of traveling. Okay, but that doesn't mean you travel to some random ass place because you save money. So this is the pitfall with traveling. The travel scenario gets dangerous because you want to travel somewhere where the surgeons are better, not the surgeons are cheaper.
Yeah.
That's a huge error. You don't travel somewhere because you can save or because you can do more for the same amount of money. That is a recipe for a disaster. Now, I am going to be biased here. I am a big fan of the United States of America when it comes to medical care, not when it comes to food, hotels, hospitality, etc., etc. But I firmly believe there is nowhere in the world with the medical care that you are given in America. Now, listen carefully. I didn't say there are no great surgeons elsewhere. There are amazing surgeons in Germany and Turkey and wherever. I'm talking about the healthcare system. When the shit hits the fan, when you go and have surgery in Turkey or in Mexico or wherever, and things don't go well, that 2%, that 3%, you're fucked.
Yeah, you're in trouble.
Because there is poor healthcare, no ICUs, there is no legal system. America is highly litigious towards patient advocacy. There are Yelp, You can take them to the medical board. You have lawyers. You have 1,000 remedies when you're in America as a patient in terms of advocacy. When you go to other countries, you are shit out of luck.
Yeah.
So it's not that the doctors are bad, but the system is not designed to be patient protective. And so if you end up needing to be in an ICU because you go into some bizarre reaction, you're screwed. Do you want to be in an ICU in Turkey, or do you want to be in an ICU at Mass General? I mean, that's what I'm talking about. So in general, the general consensus is A, if you know that you can get excellent care locally, stay local. There's no point in traveling to New York or Beverly Hills. If you find a guy in Michigan, that's amazing. You're foolish. Having said that, if you cannot identify someone you love, do not just settle. Travel to another country, travel to another state, do what you need to. Save the money. And do not travel to some random ass place in the world because you saw it on Instagram or TikTok. If something doesn't work out, which it doesn't in 2 to 3% of the times, you will be very, very unhappy. It's very, very important you understand that. So when it came to your traveling, was there any kind of advice you give to people? Because at the end of the day, you had to plan A, B, Z, D. You had to plan from A to Z. So how did you plan it? How did you put it all together?
Honestly, it was so easy. I came 2 days prior to my surgery.
Right. So we can examine you, right? We have to examine you.
I had my pre-op with you,
Correct.
and I had a COVID test. And then I walked in, surgery day, easy,
Right.
few hours, and then I went back to my hotel. I had a follow-up 1 week post-op,
Correct.
and then I had another follow-up 2 weeks
2
post-op.
weeks, correct.
The flight is only 3 hours, so it's easy. It's not a big deal. I was in on the morning and then out in the late afternoon, super easy. And then I came back the following 2 weeks. I think it was one month.
1 week and 2 weeks. And then we saw you at your 2 month. And then we'll see you at your 1. And then we see you at your 1 year.
Yeah,
I mean,
it was easy. It was super easy. And some people might say, oh, I have kids, or oh, I have my work. But honestly, it was 1 day that it took to do a follow-up. And, we have 3 kids at home. I was able to do it. So
you have 3 children and you were able to do it. And the reality is that if you can't do it, don't do it. Don't do the surgery. If you can't do all the moving parts, it's like if I can't afford the child, I don't get pregnant. Like if you can't follow through with all the moving parts of having surgery, then just don't do it. But it turns out, and I do agree with you, that when you get down to it, the nuts and bolts of it, it's really not that bad. Yeah. And the truth of the matter is it's quick. It's one time, you knock it out, you go on with your life, and hopefully, you're left happy. And there's no price for happiness.
Your staff is so accommodating. They would schedule me in the afternoon so it would work with my flights, and they're all just so lovely.
Yeah, I mean, we want you to be happy at the end of the day. Yeah. You don't go into this kind of work if you want to be a pain in the ass. So, you have to do what you can. So listen, we're so happy that you're happy. We're so happy that everything worked out. And we're so grateful that you came on the show, because the truth of the matter is that I can do all these shows by myself, but the shows without your presence and your contributions are kind of shallow. And the reality is that we need your perspective so that we can give credence to the concepts, because me telling you that, listen, I think you should travel if you think it's not, and then you saying it is totally 2 different things, because you actually did it. Yeah. As always, we're so grateful. Thank you for being on the show. Those of you who are listening, pay attention. If you like our show, go write something nice. We always write negative things about things. Why don't we write nice things? Go write something lovely. It makes the whole staff, everyone involved in this podcast, so happy. Secondly, if you love someone and you think, gosh, they may benefit from the show, share it, contribute, so that they may check out an episode, and as a result of that, maybe be careful and do the right thing. As always, we're grateful for everyone tuning in. Till next week, I'm your host, Dr. Rady Rahban, signing off on Plastic Surgery Uncensored. Marissa, thank you so much.
Thank you.